Picture this. You're a psychologist, someone trained to help others through mental health struggles. You never thought you'd need psychiatric medication yourself, but one day, after moving across the country for a high-stress job, your doctor suggests an antidepressant, Celexa. You don't think of yourself as depressed, but you are desperate for relief, and so you agree to take a low dose, just for a few months. What could go wrong? But soon, everything does. You try and stop the medication, but your body fights back. Hard. Withdrawal symptoms hit you like a freight train. Anxiety, panic, physical reactions you can't even explain. You know you need to get off, and so you keep trying to cut down, slowly. But the more you try, the worse it gets. Suddenly, the medication meant to help you has become a trap, and no one, no doctors, no friends, understand what you're going through. It's a nightmare scenario, and that's what we're going to be talking about today. We're sitting down with Gloria, who went from treating patients to becoming a patient herself, trapped in a battle against a drug that wouldn't let go. What happens when the very thing meant to help you becomes your worst nightmare? Let's dive into Gloria's harrowing journey. I'm Dr. Josef Witt-Doerring. It is my pleasure to be joined today by Gloria. Gloria will be talking about a protracted withdrawal injury from Celexa, and she brings a unique perspective as someone within the mental health field, as a psychologist. And so, Gloria, thank you so much for agreeing to come on and share your story.
Yeah, thank you.
Yeah. I think a good place to start with this is to start right at the beginning. How did you end up on Celexa in the first place?
Yes, I was actually not really that open ever to take antidepressants, but I got a job that I moved from. I live currently in Pittsburgh, Pennsylvania, but I moved from Boulder, Colorado to Philadelphia, Pennsylvania, and I had a job that was very stressful, and I had some hormonal issues. And I actually did not respond well to this bioidentical hormone. And the doctor, just a PCP that I found there, suggested I take a very, like a subclinical dose of Celexa. Now, I knew it was an antidepressant. I wasn't particularly depressed. I was stressed out and I had hormonal issues. And I thought, well, I'll try for 3 months. So it's an off-label, prescription.
Mm-hmm.
And I thought I'd try for 3 months and then kind of come off. And the reality is, so I did. I almost said no, and I thought, well, I'll try it for a short time. And then I called her and I said, I don't want to do the 10 milligrams. I'd like to do 5 milligrams. And she said, okay. And at the 3 months or so, 3 or 4 months, I actually tried to get off under her supervision, and I couldn't do it. I had symptoms. I felt terrible. She was suggesting things like cutting half and then another half, 2 weeks, that kind of stuff that I know much better now. And so I decided to stay on it because I have glaucoma. So I needed to have they wanted to do probably a surgery on my left eye. So I thought, well, I'll wait until I go through the surgery and then stop at that point. So I stayed on it at that very low dose of 0.5. And but I knew something had happened. I wasn't able to get off it without having some major symptoms. But I didn't know anything about, slow withdrawal or, any of that stuff at the time. So that's how it got started for me.
Mm-hmm. And how did you feel about continuing to take a medication that you never wanted to be on in the first place? I guess after you couldn't come off.
I felt terrible. This is one of those things where, you kind of have a regret. I don't have many regrets in life, but that was one. Why did I say yes? But I was afraid of, I just started that job. I was afraid I was going to lose the job. But when I couldn't get off of it, it just threw me into this place of, I'm one of those people who maybe takes vitamin D and Tylenol, and so it threw me off in one of those places of what's going on here. And then I thought, well, okay, after, I'll just stay in it. And then after the surgery, I'll just try to come off again. But yeah, I felt pretty terrible about the fact that I was affected that way in 3 months that I tried it.
So you take the drug for 3 months, you try and come off, it doesn't work, and you stay on. How long did you stay on before you started either having problems with Celexa or deciding to come off again?
Well, I had that surgery in 2016, which was a couple of years later. And then at that point, I came back here to Pittsburgh where I had a house and had the surgery here because I have a son here and he could support me with it. And I was okay the first month. Of course, I was on an antibiotic drop and that kind of thing. And I was okay. But sometime in March, I started having really odd symptoms and, like real reactions to allergic reactions that I didn't have before, like severe allergic reactions to to the fact that the spring was coming. And then I started also, and I didn't realize that I was having symptoms to food. So what I did was, I really got worried about the whole thing. And then, so I went to an allergist and I got tested. I talked to the doctor, all of that kind of stuff. And I even called the surgeon over here and said, I'm having these symptoms. And he said, well, I don't know that that has anything to do with the surgery. So, the way that I found out about that was related to the antidepressants, I thought, I wonder if it's a combination of the antidepressant and the antibiotic, and things are, kind of not matching up. And I wasn't planning to stop right there. I was going to wait a couple of months, and I did a search. I did a search on drug interactions, and when I did the search, what came up for me was actually surviving antidepressant. And so I went to surviving antidepressant. And when I started reading the cases and I started reading the information there, I realized that I was actually having withdrawal symptoms. I was still on the drug at 0.5, but somebody actually had a commentary where they said they had the same experience. That if you go into surgery or antibiotics, sometimes even if you're taking the drug, it just throws you off. It can throw your system off. And I read and I was having a lot of the same symptoms that people were having.
What kind of surgery did you have?
I had a glaucoma surgery on my left eye to reduce the pressure.
Okay.
Yeah.
So after that, and so how long were you on the medication? And you didn't even change the dose, right? You just did the surgery and then
I didn't change the dose. And then when I found out that it had something to do with the antidepressant because of just reading and every test that I had came negative, right? I actually got really worried about, and I became very, very anxious, and I did mess with the dose a little bit there. And then I started having really severe symptoms at night. I remember having like heartbeat anxiety, just really things that I don't experience usually. So I had joined the forum, Surviving Antidepressants. So I asked, this is going on with me, and I'm also having symptoms that I don't know where they're coming from. I'm coming out negative in all the testing. And then two things came up. One, that I was probably reacting to the food. So I might have some kind of histamine sensitivity. I was also reacting to the environment. And the other one that came up was, if you're messing with the dose, that's probably making you feel worse. You need to stabilize. So that's how I learned that, I didn't know. I just thought if I cut some and increase then because my symptoms are so bad, So I stabilized, although I was very, very sick. I had to actually take a leave from work because I was having so many symptoms at night, severe anxiety. Also couldn't eat things without getting, once I realized I was having reactions to food, I didn't know what or how to go about it, dealing with that. So I took a leave, a partial leave. I was working a little bit part-time, and I figured out and found actually a dietitian that worked with histamine issues, and she really helped me. Between that and the advice from Surviving Antidepressant about stabilizing, and then people said just stay there, and I had gone up and thinking that going up will help, and then they said stay, and so it was about 7.5 milligrams that I stay at that time, and then I stabilized after about a couple of months. It took a while. I was in real distress for a couple of months. Yeah.
And so how did things play out? So you discovered that you're actually having withdrawal problems from the antidepressant. Were you able to stabilize? Did things settle down from you?
Yeah, things stabilized because I followed their advice. And I also limited
Yeah.
my diet around the histamine. And
Hmm.
I then was able to kind of go back to work. And then, my job was very, very stressful. So even though I stabilized, I wasn't having anxiety or, really fast heartbeat and those kinds of things. I actually was still having food problems. So I was and also I
Hmm.
was reacting to the environment in the place where I worked as well. And then I was reacting to the stress of the job. I had a very stressful job at
Okay.
the time. Yeah. So although I was
And
stable, in
so,
some ways I was still reactive.
yeah. And so walk us forward from there. What happened next in your, I guess, your journey off this medication?
Well, then doing some research myself, I'm sort of research oriented myself. So I did a lot of research, and certainly surviving antidepressant was helpful. Also by Lisa at the time, I talked to her
Yeah.
on the phone, and just looking online as well. I just thought, oh, okay. And they were advising cut down 10%, every 4 weeks. I had to move. They asked me to move from this place that I was living to. So I got another apartment and I moved. So I waited until I moved, so I moved. And then after I moved, I started cutting 10% every 4 weeks. And that was several months after I had stabilized. So I say I stabilized sometime in the summer, end of summer. At the time, that was 2016. And then in January of 2017, I actually started cutting down like the 10% every 4 weeks from 7.5. And that's how I began a journey that it took a long time. It took me 4.5 years to completely jump off the medication.
What were some of the struggles that you encountered on the way off?
Well, there were many. One of the things is I quit my job because I just couldn't handle the stress. And I had a house here in Pittsburgh, and I decided I needed to come back here, maybe find a job here. Needed to do some work on my house and so on. So I became unemployed, and I mean, I quit for the first time in many, many years. And although I had stabilized some, I was in a limited diet. I lost a bunch of weight actually because I limit my diet. At the time, I wasn't really afraid of eating I developed that later on in the latter part of my journey, but I was really not eating much just because of the fear of just the kind of symptoms that I would have. And so that was kind of like the beginning. And then I left and came back here to Pittsburgh. I was relatively stable at the time. I could actually probably I could drive and come back here and did the move. But a few months later, after I was here and sort of stable in my house and everything, and as I kept cutting down, I just kept having symptoms, a lot of gut issues, ringing of my ears, which I still have, and associated with my gut. And I was able to sleep. I started sleeping better, and because there at the beginning, my sleep was very affected as well. And I didn't have severe anxiety by the time I was stable and started cutting down. That came out later, but I actually started trying to find a job here and I couldn't. So I haven't worked since then. I'm older, so I would have retired, but I wasn't ready to retire at the time. And
Hmm.
I wasn't able to find. I worked part time for a year. The first year I was here, I worked part time, and I was consulting with the place that I had been working at. So, but then after that year, which was 2018, I actually haven't worked for pay since then. Um,
And just reflecting on your time tapering, people are going to hear 4 years and say, "Wow, that's a long
mhm.
time." What was it about what you were experiencing during your taper that made it that you had to taper in such a slow way?
Because if I had symptoms, if my symptoms get worse, if I had anxiety or if I just slow down. And sometimes like for example, after I had tapered some in Philadelphia in 2017, and then I just took a break as I was making the move here, and that was
Hmm.
several months. So I didn't taper during those months. I was down. I don't remember exactly where I was, but I stayed for about 4 or 5 months. I stayed there, And
Mm-hmm.
and then once I was stable here in Pittsburgh, I started tapering again at the same rate. And if I felt like I had a lot of stress or I felt like symptoms were increasing, I would just kind of wait it out for, for a few months, 2 or 3 months, and then I'd start tapering again. I was using a liquid formulation. I was able to get a liquid formulation because I have a visual disability. It was really hard for me to do the pill. So
Mm-hmm.
I use a liquid formulation.
What was it like to finally come off after working at this for 4 years?
Well, the last year, so I could tell you about the last year, um, I developed an eating disorder. I had a surgery because I had some problems, some gynecological problems and so on, and it was necessary. Now, I had postponed it for a while because I was afraid of surgery again. But I had it, and this was during the pandemic, by the way. So the pandemic hit 2020. I had surgery the summer of 2020, and I developed very, very serious gut issues. Couldn't eat anything, couldn't eat any carbohydrates very much without getting really sick. And I was still tapering, but it was my last year of tapering. And I lost 45 pounds. I've gained some of it back, but I lost 45 pounds that year. And I developed
Mm-hmm.
a fear of eating. So prior to that, I was just being careful about the food, but here I actually developed like an eating disorder. I mean, I was down to like 9 foods, and that was, and even with the 9 foods, I was still reacting to them. I was reacting also to supplements. So say like any kind of vitamin that I would try, I started to react
Mm-hmm.
to things. I became very reactive. And luckily, I'm not one of those people who was on a lot of medications and so on. But I developed fear of putting anything in my mouth, right? Whether it was a supplement. I mean, I did take Tylenol occasionally, but whether it was that, a food, uh, and it kept just losing weight. That year, I kept tapering at the very slow 10%. But I already knew from reading, I read a lot. I actually know quite a bit, not only about this, but all kinds of things. I know more about medical stuff that I ever wanted to, right? And because you
Mm-hmm.
cannot get answers, right, from doctors, they don't know anything about it. So if you don't take it on your hands, thank God for surviving antidepressant and I read some papers, research papers and so on.
Mm-hmm.
And I just kept getting sicker and sicker that year. It was devastating for me because I wasn't as sick as I was going to be when I finally made the final jump. But I've never had an eating disorder, and I don't know that you can call it an eating disorder. I mean, I don't have it anymore, although I'm careful with what I eat. But I was living with somebody, a friend, and then my food just went really crazy. I had sold my house. That was the other thing. I did sell my house and moved in with a friend, uh, and kept losing weight, and kept eating less and less and being afraid of anything that I eat, and so that was really hard for me. But I was still sleeping okay during that, and I didn't have anxiety at the time or depression, but I was, kind of I was kind of phobic, of putting anything on
Mm-hmm.
my system. But I kept at it. I thought, I don't care what happens. I'm going to get off this thing. I've been working on it for several years and, with breaks but still, so I was very committed to like get off this drug, I mean, it was so terrible. It was just been a long journey for me.
What was it like when you finally stepped off the Celexa once and for all?
Yeah, so I got a little confused with the measurement, and I might have actually jumped a little bit higher, or maybe I was a little bit lower. It was just really difficult to keep that. So I jumped off, and at first I was okay. It's an interesting thing that it takes a few weeks sometimes to really things to hit you completely, and a few weeks later, I mean, all hell broke loose. Like and I developed, I counted at least somewhere between 20, 25 symptoms. So in addition to the food issues that I already had, I developed severe anxiety. I started having panic attacks. And, I mean, I've had some anxiety in my life, but, usually circumstantial, right? And
Mm-hmm.
normal kind of stuff. But I had panic attacks. I became very depressed. I wasn't eating hardly at all. I couldn't sleep. So I became, not able to sleep. I would go nights without sleeping. And then I will sleep maybe a few hours, or sometimes I sleep one night and then the next day I didn't. And then I actually had I may still have a little bit of it, I don't know, but anhedonia, a lack of feeling anything, DPDR, I had some of that. And, uh, and then the person that I was living with, my roommate, she just freaked out about the whole thing because I think people don't know what to do with this, right?
Mm-hmm.
And it was just a complete, everything fell apart. I sold my house. I didn't have a job, although, it was time where I was able to get Medicare, so I turned to the age where I could do that, so I actually was lucky to have that. And, um, so I was in a very, very big crisis. I mean, when it hit me, the first like 3 months, 2 or 3 months were really, really terrible.
Mm-hmm.
And I was exhausted. I asked her to take me to an emergency room, and I wanted to get something for sleeping because I wasn't sleeping at all. And it was a horrible experience, of course. And they didn't give me anything. And I'm kind of glad, because in a way, I have actually done this. People have told me to take this and take that over the years. And I made the decision. At some point I was tempted and I tried a little bit of this or that, like a sleep thing. And at some point I said, I'm just going to have to do this on without anything. And, without anything,
Mm-hmm.
meaning drugs. I did do other things, but acupuncture.
Sure.
I did acupuncture, which was really helpful for anxiety.
How did you feel about, given everything that you went
Mm.
through? I mean, getting hurt by the drugs and then spending 4 years coming off. When you reflect back to the doctor who put you on Celexa for either perimenopausal symptoms or side effects to the bioidentical hormone replacement you were doing, how do you feel about what that doctor suggested to you and the treatment they
Well,
prescribed?
there's such a tremendous amount of ignorance, and I know it's not bad intention. I don't think that she knew anything about these, but this seems to be the common experience, right? I have a great PCP right now who's open to be educated, believes me, and I'm all of that good stuff. So I'm very lucky to have that. But everybody else that I've talked to her, including her, and then later on a psychiatrist, I got into a program um, for dialectical behavioral therapy, and I had a psychiatric consult. People are like, well, we never heard of this before. You're the only person that we've ever heard of. Of course, I've been in support groups and surviving antidepressants, so I hear that everybody is told that often. I was a little upset about her. I said to her, I am being affected by this drug in a way. This was in the early stages. And I said, I'm sending you a link to surviving antidepressants so that you can read what people are going through. And I hope this is helpful and you think more carefully when you actually suggest this kind of drug to people. So I sent it to her. And then I left Philadelphia and ended up with a doctor that I really like here. I still have her. She's just wonderful. And that's rare to find. But to me, it's not even the doctor. To me, it's more of kind of a larger issue, right? And it's a larger issue of people's ignorance, and also something that I've been interested in most of my life, which was the application of the medical model, this rigid medical model to psychological issues. And
I'm glad you're talking about this because I want to ask you, how did your experience change your view of the mental health services
I was
within this country?
yeah,
Yeah.
I was already an alternative kind of person. I mean, I have a PhD from Duquesne University here in Pittsburgh and existential phenomenological approaches to clinical psychology and a humanistic psychology. So I had actually been committed to that. And I was already leery of medication. And this, I was so desperate with my job that I was willing to treat. I just didn't think that trying a little bit would have this effect. I think the difference for me, so I already knew that the kind of narrow views of psychiatry and psychology, not all psychology, but some aspects of psychology in the medical field were actually, based on a paradigm that I didn't think really made sense. I actually was a professor in my latter years. I was a therapist in my early years, and then I became a professor. I trained people at the master's level, and then later on went to work doing both teaching and leadership positions in small colleges. So I had already kind of like that view, and this just so confirmed it for me that service providers and psychiatrists and so on, and primary care doctors and some psychologists and are actually in that narrow view, and they're not looking at the whole person and all the elements of the whole person, which is something that I used to teach. I used to teach that to people. I used to teach to our students, our master students, to actually look at people in this broader sense, the social aspects of it, and as well as the spiritual aspects of it, and that kind of stuff, rather than this narrow materialistic view of disease. I knew that there was not such a thing as a brain illness, which is how we kind of construct that. We construct this whole thing as if it was a brain illness. Of course, I know much more now than I did then. So to answer your question, it broadened my view as well as it gave me the personal experience, which is kind of like the silver lining. It's a terrible silver lining to have, but I really see it, and I'm amazed that even though the evidence out there, so many cases, that this blind spot still rules how doctors and psychiatrists see this issue. The people cannot believe that this medication can do this level of harm.
And so, Gloria, what I notice a lot is when I went through my training, it's a lot of the psychologists and the social workers and these mental health professionals, they'll defer to psychiatry.
Mm-hmm.
They will, that's what the doctor says.
Mm-hmm.
And in many ways, they follow our medical model, which is one of, really kind of based on a, biological mental illness. It seems to be all that we talk about. Given your vantage point as someone who is training psychologists, are you finding that psychologists, early career psychologists, are asking the same questions that you were? When you said that you were kind of suspicious of how we were looking at things, are these questions coming up, or are they kind of just going with the flow?
Yeah,
what do you see?
That's a very good question that you're asking me, because I actually train licensed professionals. I'm a psychologist, but I train master's level, which are licensed, as a professional counselors, and I happen to have a humanistic oriented training and a real broad view of things. And I was very interested in the critique on the medical model for many years since I was fairly young. But that is not my experience when I was training folks. And what I would do is that I would actually bring articles and perspectives that were different, because I thought, really, people are going to go out there and they're going to be in a world, we have Western Psychiatric Institute here in Pittsburgh, which totally works on the medical model, So they're going to be going out there working, say, in that particular place, or, there's also community mental health, before they go into any kind of private practice. And all of those places are coming from that perspective. I'm not, and I came from a training program that happens to be in Pittsburgh that does not train us that way, but other people are. So yeah, I see that other colleagues that I had, they had a different training, and I have a number of colleagues and so on, were actually, deferring to the psychiatrist. They, that is very common. When I worked at Chatham University here in Pittsburgh, as when I was a professor and a master's in counseling psychology program, we had a counseling center here. I'm friends with the director to this day. Students go on crisis all the time. I mean, first of all, they were coming, and this at the time it was at the undergraduate level. I taught at the graduate level. They were young women, because it was a women's college that went co-ed in 2016, and my friend told me that about 30% of these young women that were coming to college had psychiatric diagnosis, and they were one medication to multiple medications. So it was very common for them to come in, and then they will go in crisis, you know, for different reasons. They will go in crisis, and then, you know, they had to end up going, because it was a small college university, they go into psychiatric care at Western Psychiatric Institute. And, you know, when you go there, you know, it's all about medication. So the solutions were about, how do you medicate? These were people, sometimes they might have been 18 or 20 years old, and some of them had been in medications, these young women, from the time they were like 12 or 13. So it was a huge, I already saw that crisis, you know. I saw that these young women were coming, you know, with this high percentage of, according to my friend, I mean, it's not a statistics thing, it's just a, you know, what somebody told me, but, you know, this high percentage of people were coming in already medicated from the time they were in their early adolescence. And, you know, I would have those discussions, because, it was, I mean, it wasn't my view at all, but what could I do, right? You know, I mean, there was a system where people, the only thing that I could do was to train people to look at things in a bigger picture way, right?
I guess what I'm hearing you saying is it's like it was maybe in some ways they're already primed with the medical model, because a lot of them were coming in treated
Yes.
in that way. Yeah.
Yeah, and there were suicides, and there were different kinds of things that occur, which occur a lot in college. So I'm not saying that this college was unique about that, but it was a high percentage of people, and I'm assuming the high percentage of young people were coming in with already within being treated in that medical model, that is relatively common in most universities. Now, a lot of the students that graduated from our programs that I will talk to, they'll go on to work in places like Western Psychiatric Institute or one of the community mental health. And yeah, they have to kind of follow the line of psychiatry around medication. They don't have any power around that, whether they feel like maybe it's right or wrong. You know, there's a power differential, right, which is what you're addressing. There's a power differential with a medical professional, in particular psychiatry, and then you know, you go through all these different levels: professional counselors, social workers, and psychologists, and that's how the world is set up.
I want to get your perspective on this. You know, I look at my own profession in psychiatry and I go, you know, why aren't people talking about the drug harms, or that the drugs really aren't working that well in the long term, and the evidence base is lacking? You know, most of our studies are only 3 months duration, and God knows what's happening past several years, whether they're still working. And in some sense, I mean, it's not forgivable, but I guess that maybe there is some willful blindness, because these doctors have to practice in this way, you know, if they're going to take insurance and work within the system, and maybe you don't want to see it. But when I look over at social work, psychology, sometimes I wonder why they're not vocal about what seems to me to be evidence sort of in front of our own eyes that these drugs really don't work that well long term, and for quite a few people end up causing problems. And I wonder why we don't hear much from the leadership within psychology and social work talking about the limitations of the biomedical model. And I wanted to get your perspective on that. I wonder if that's something that you wonder about as well.
Yeah, you know, I think that most people that are trained in social work and psychology are being trained within that particular perspective, that paradigm, you know, or the biological paradigm, the paradigm that says there's such a thing as a mental illness, and that mental illness can be traced to something in the brain. Now, they're also trained, I'm just saying that, but they're also trained on looking at the bigger picture in some ways around social issues of trauma. Something that is really promising right now, I think, is that, you know, now we're paying really close attention to trauma, you know, to the effect of trauma in the body and to the effect of trauma in people's lives, you know, so there's some of that. But I see this as a power issue. You're absolutely right. I happen to have chosen to go to programs that were actually like a humanistic psychology perspective and a phenomenological existential perspective, who actually critique these models of understanding what human life is about. But that's a minority within our field. That's a minority within the psychological field and the social work field. It does exist. And some people do write about it, by the way, but they're not known. They're kind of like on the edge, right? What's known is that people go and get jobs and they defer to the psychiatric world as knowing, not necessarily as knowing more, but they're the ones that deal with medications. We don't. That's one of the things that I hear, that we don't know anything about these. Why people are not more advocates? I think it's still a minority. There are people, I have friends, and people actually know these. A lot of people know that psychiatry is really flawed, and that the biological aspect of psychiatry is really flawed. And and that I don't know how much advocacy is there right now. I know usually what I know is that some people that are coming from more of a left field like I did, have an awareness of that. But I don't know that people are really speaking up. There's also a lot of blind spot around this thing. If people speak up about these, it doesn't get press. I saw an article in Psychology Today, not that long ago, a few months ago, where somebody was actually talking about this issue about, what's going on. The people are really affected by these medications. We're not saying anything, but those voices are not there. They're not heard, or they're few and far between. So,
Yeah.
I mean, that's my perspective on it. I am
Thank
actually
you.
very
No.
interested in advocating and helping others with this issue. Now, I have still not feeling well, by the way. I'm still in this protracted withdrawal or this injury. I'm still suffering from the injury. So
Yeah, tell us a little bit about that. How long ago did you come off Celexa?
so I came off. It'll be 3 years at the end of this month. So I'm in what is called protracted withdrawal, or they're calling it bind or a bind now. Or
Yeah.
nervous system injury. There's different ways of doing that. And of course, I very gradually have gotten better. And, but with a lot of, I get better and then I kind of go down again. Seems like every spring, last spring and this spring, I've been really affected by the environment. So I still have symptoms. Some of the symptoms are my sleep still never has completely normalized, although I sleep now and I'm glad for that. And I also have still gut issues, although it's a little better. I have silent reflux that I never had before, and it affects my sinus, and it affects my ears. So I have sinus inflammation. I have noise in my ears, and it affects my eyes. And I actually lost a lot of vision during this years, the pandemic, and I had a cataract surgery on my right eye. And I'm not sure, did I lose this much vision because of the glaucoma continue? Or some of these is a distort. I haven't done the cataract for the left eye because I was afraid of it. So I'm still very affected. I don't do a whole lot. I can't drive anymore. And I get out some, but not very much because I still have what is called hyper emotionality, where my physiological reactions are if I have too much stress or if I have normal feelings of sadness or grief, I kind of feel it more. And I also still go through periods of actually not feeling anything, where I'm just numb. And I have a little bit of that derealization still going on. Now, sometimes I think, is it because I have low vision and my vision is so poor right now, or is it really still the nervous injury, the nervous system injury? So my life was, I've learned a lot through this time. So I'm not, because I continuously read. I'm a Buddhist practitioner. I have a spiritual practice, do a lot of meditation, know how to get network of friends and so on to be connected, with me. Go to some support groups, but it completely changed my life. And this is now when was it that, 8 years ago that I first had the symptoms, well, even longer, 10. You think about the time when I decided to stay. And here I am after I quit 3 years ago, and I'm still having symptoms that actually limit my life. Because even with a visual disability, if I felt normal, say, I could just go on the bus, but I don't feel well a lot of the time. So for me to go on the bus with a visual disability plus the issues that I have. Excuse me. Uh,
It's okay.
it can be pretty tough. Now, for the first time, the good news is for the first time last weekend I did an event. I have some groups that are part of it over here, and we did like a retreat program where I was on the lead for it, and we had a planning group, and we did it, and it went really, really well, and I was able to go. But I was having just in the last few weeks, and I think it's because I was walking outside, and I got huge reaction to the tree pollen. I was actually having dizziness and balance issues because my ears got affected from my sinus, and I'm still having some of that. It's not as bad. I'm still having some of that, and so I go through these things. Um, and I mean,
Hmm.
I'm in the support group with Belisa. I still read Surviving Antidepressants once in a while, and I try to read people who did completely recover. And that most people actually recover, but it might take years for some of us.
I was wondering, because you are recovering and I know you're connected within the community, if you could um, maybe share a message of hope
Yes.
for other people out there who may be going through something similar. What would you say to someone who's early in their journey and they're suffering?
Yeah, you know what I would say? I would say, yeah, that, first of all, I would affirm and I say, I'm sorry that you're going through this. And it is very difficult. And it's very difficult when you're out there and people don't believe you, all that kind of stuff. But on the other hand, and looking at my own journey and some of the people that I've gotten to know um, that are experiencing the same thing, I do see the progress, and I see that most people heal, and that the healing could be slow for some people, fast for other people. You never know. It's very different for us. So kind of hang in there. I think staying connected. A lot of people become very isolated, and trying to find whatever connection you can find, even if it's online with other folks that are going through the same thing, a support group. But for me, staying connected was also finding things that were interesting to me that I could keep, like my spiritual groups and things like that I could connect with them. And that in itself has just really helped me cope, finding different ways of coping while you wait. I always remember the Belisa says that, and but then no, and read a lot of stories about people who recover. I go back to surviving antidepressants, and I read stories, and in Belisa's group I listen to stories that she's taped, and I continuously keep that hope, and then I see sometimes the path is very gradual and you don't even know that you're getting better. So I say, hang in there, try to find a connection. You will get better. You will get better from this. And I feel that I have gotten better from the kinds of things that I told you when I had 20 symptoms, 25 symptoms to now. Much better since then.
Mm-hmm. Thank you. Well, Gloria, I think I'm out of questions, but I want to thank you for coming in and sharing your story. Is there any message that you want to end with, or anything else that we didn't cover?
I think we cover pretty much everything. I do want to make sure that I like your question about how come, and I'm not in the mental health field right now, but how come people in the mental health field or training programs are not actually advocating and taking a stand or just even looking into that. And I feel like that could be something that I could also get involved in, kind of trying to understand. I'm in therapy myself, and the person that I see is, very open to all of that. And then I've been doing some specific things with somebody else, and they all agree with me. But I haven't thought about the question that you asked: how come people in both psychologists and social workers and counselors are not actually out there advocating for a different kind of
Mm-hmm.
treatment? Like I did it when I was training people, but I'm not in that world either right now. So who's
Yeah.
doing it? First of all, I don't know who's doing it. Is anybody actually doing it? So that's something that interests me that you say. How do you get the message out there to folks? Certainly I'll be glad to. I'm not doing any coaching or support right now, but in the future, I would love to do something like that. And But I like to work in both areas, the advocacy as well as supporting people. Oh, one thing that I wanted to tell you was that I connected with somebody in one group here recently, and she had asked if I could help with Spanish speaking people. So there's nobody right now in the world apparently who's helping Spanish speakers. Certainly not in the United States. She's in Spain, although she's American. So one of the things that she suggested, and I don't know if you could do that, is whether there could be, any kind of translation on the bottom. How do you call those things?
Such a good idea. Yeah. I have to find out how much it would cost to have someone do that
she suggested
for us.
that.
I'm glad
I remember because I meant to tell you. So one of the things that I want to do is just being able to also, because I'm a bilingual. I speak Spanish. I grew up in Venezuela, South America, is to be able to help folks that do not speak English, and so she suggested being able to have that translation.
That's such a good idea.
And then
I need to look into that.
And then that can be sent to folks. There are these networks, and they can share with other people. And I told her I'll be glad to talk to people that were open to speak about this issue in Spanish, because and actually Belisa has suggested that I become a coach because I have all the psychological. I'm not practicing, but I have all the skills, but I haven't felt well enough, in all honesty, to do that. But I did this event last weekend, but being able to kind of be available to people who speak Spanish, or to have some resources in Spanish for people. That's the one thing that I think I can add to your question.
Wonderful. Well, Gloria, thank you so much, and I'm looking forward to seeing what you do in this space.
Okay, thank you very much. Okay, thanks for inviting me. Okay.
If you're interested in learning the safest way to taper off antidepressants with your doctor, please check out this video next.